Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Welcome to the Cardinal Minute. I'm very pleased this morning to have Dr. Jeffrey Callen, who is our Chief of Dermatology, a division of the Internal Medicine Department here at University of Louisville. And he gave a wonderful grand rounds on some very difficult dermatologic conditions. Can you summarize it for us, Dr. Callen?
Yep, thanks, Dr. Williams. I presented today 4 cases which we would consider to be complex medical dermatologic diagnoses. And it was to illustrate at least 4 different points. The first case that I presented was a patient who was misdiagnosed as lupus paniculitis and treated with therapy that did not help her at all. It was only when we recognized that her diagnosis was cutaneous plasmacytosis associated with systemic symptoms and an elevated interleukin-6 that we were able to treat her in an off-label manner with tocilizumab effectively. Our second case was a patient who had not been assessed for internal manifestations earlier in his life. He was a 14-year-old boy who had a cardiac arrest, was resuscitated, but then after his cabbage was found to have lesions on his skin indicative of hyperlipidemia. They were tuberous and papular xanthomas, and he was successfully managed by addressing his lipid abnormality. The third patient that I discussed was a patient who had pyoderma gangrenosum. It's a disease of exclusion. But the therapy that had been initially given were antibiotics, which are not useful for pyoderma gangrenosum, and then a short course of prednisone, which is not an appropriate dosing for the disease. And then the last patient that I presented was a patient with a Waldenstrom's macroglobulinemia and a lymphoma, whose disease was worsened when they were given appropriate therapy, on-label use of rituximab and a chemotherapeutic agent, but the rituximab resulted in a paradoxical elevation of cryoglobulins and a cryoglobulonemic purpura.
Well, that was wonderful to know that you've had such an impact on these patients. These are very difficult cases, and hoping that everyone who is interested in any of those 4 cases can just scroll back through the grand rounds if you're not able to listen to the entire thing. And you should be able to scrub your way to the particular cases, because being able to recognize these in your own patients is really why we do these educational sessions. So thank you very much, Dr. Callen, and that ends the Cardinal Minute.